The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
But what were the overarching takeaways from the whole meeting, from the lectures you attended?
So they do the same things that we do. However, having said that, one of the interesting things is in terms of deep plane facelift, they are all in. I'd say 80, 90, maybe higher than 90% of the facial plastic surgeons are doing deep plane. I do think in our field of plastic surgery, it's not 80 or 90%. I'd say we're still discussing it a lot, maybe 20 to 40%, because really they're all in. So that was very interesting. The other thing that they do is that they're sort of all in on the deep neck lift, where they're pretty aggressive about removing the structures underneath the platysmal muscle, the neck muscle here. More of them are doing more of that.
Okay.
And then I did learn a couple tweaks, which were very interesting as well. You know, of course, we can do endoscopic brow lift. So in other words, you make tiny incisions in the scalp. You have a curved camera where you can see everything and dissect everything under here and really lift it up. I saw a facial plastic surgeon who uses all the equipment but doesn't use a camera. And so he's able to safely and quickly elevate the eyebrow a moderate amount, but not like as much as you can visualizing everything. But having said that, a lot of patients only need a moderate amount. You save so much time. You can do it very safely. You're not like damaging anything. I've never really thought about that, but that was actually very cool. And I think the biggest thing that I saw was there's a plastic surgeon, not even facial plastics. He was invited to talk because he does deep plane facelifts under local anesthesia.
Amazing. What were his?
I think the biggest thing was you still need patients who are, yes, they get a lot of local anesthesia before the beginning of the case, and they also still get oral sedation. He actually has 2 scrub techs. So typically when you do things under local, it might be the surgeon by themselves, or it might be the surgeon with 1 assistant. He actually has 2 assistants. So it's not for monitoring or anything like that. It's much more about like positioning the patient, his body position, what he's looking at, who's holding what. And he feels that actually delivers a better result.
It makes it easier for him.
Yeah.
So yeah, I think it's true. I think when we do things that are local, we usually have less help than in the operating room, which is like a more formal setting. So there's more people around. Really, really interesting. I did, especially during the pandemic, I was doing a lot of things under local, and I've kind of like, I was doing everything under local, like things that like now I'm like, I can't believe I was doing that under local. I mean, it worked, but I just felt like sometimes it was a little bit variable, like how comfortable you get patients. Like some people would just be like sleeping, and other people like really, you just seem to not be able to get them as comfortable as you would like. And so it was like that variability. And I liked it being the same every single time. So yeah. I went away from that. But I did some of my facelifts under local, and the patients would just like sleep the whole time. It's just, you just wouldn't know.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.